This piece of work, which is called really Memory Aid to Structure and Support Daily Activity with People for Dementia, is a piece of work we've done when I was working in Netherlands, sort of on a joint collaboration with Saxion University. So as part of this work, we already published 2 pieces of paper. So if you're interested, you can have a look and and get really detailed information. So basically, the idea behind this piece of work was, as you all know, dementia is increasing worldwide. And in Europe, only actually in 28 countries of Europe, last year the figure was something around 8 million, which is an average really 1.5% of population suffering from dementia. And it is predicted that the figure will double by 2030. So it's a big public health issue. And we know that is partly because the aging profile of population are actually increasing. So the use of technology is becoming more and more important, and we already seen a number of very sophisticated tools and tablets for a variety of needs. This one was basically really a tablet to help and support the memory of the daily activity in a small residential area in the eastern side of Netherlands. So the idea was to really help patients suffering from mild to moderate dementia live as independently as possible, but also actually to use the tablet to stimulate them, so then it's not only to become dependent all the time. And the way it was worked was, actually I think I have that one. Okay, I'll come in a minute. So what we did was, in collaboration with our undergraduate student at Saxion and postgraduate, we did an extensive research to find out the needs of staff and from informal carers as well. Because as you all know, dementia, even if we consider mild or moderate, it could actually vary enormously based on other psychological problem or physical health problem patients might have. So they are not really a diverse group of patients. But in the Netherlands, in the last 10 years or so, a number of healthcare homes with sort of a small-scale residential home have been developed, looking after 8 to 10 patients, so quite small. And patients tend to be accommodated in a place based on certain similarity, like sort of functioning, like physical ability, etc. So for this tablet, 3 phases of development or cycle of development took place. In the first cycle, an inventory of the needs have been assessed by our student. And then we have done a pilot. When it has been developed, we actually did a pilot of the first phase of implementation. And the main issue was to find out, is it useful? Do people use it? What are the advantages and disadvantages? And how we can develop it further. And this paper, I'm really just presenting the process, what we've done, and only the first phase of the finding. So, can you see it? So first, as I said, we started exploring the needs, then developed a sort of prototype of what is needed, and it was tested. And this was, apart from that care home, an institute with a sort of software engineering was working with us. So the tablet is sort of the main box is in a living room, and then each resident has a tablet a digital planning board in their own bedroom. And if I just show you, these are, for example, the residents in that small caring home. And so if you touch the photos, the daily activities will show the daily activities. So anybody can actually touch, but some of the really general, not private issues, anybody can see, like, dinner time, coffee time, walking time. But in the bedroom, there are some private and confidential issues, for example, when it's a time to take bath, or et cetera, et cetera. So there are two different levels of activity. So, as you can imagine, with any new things, when you develop, when you put into implementation, even if it has gone through extensive consultation, staff were really overwhelmed because patients could not use it, so their daily workload has increased. So that was the biggest learning lesson in terms of how long one needs to take on board when implementing a new device. For our pilot study, we have interviewed 6 residents and focus group interview with informal carers, family members, but also staff. Now, for those of you who may not have done research with a patient suffering from dementia, that was one of the most challenging aspects of it, but it was really interesting how much input they could make if one had the flexibility to take frequent break from conversation. So that was quite interesting. And one paper is just to talk about the process of actually working with people who have limited ability to concentrate. A number of issues have been highlighted. As I said, the main theme was what are the advantage and disadvantage of this tablet, and how we can develop it further, and what learning lessons was there, and how this can be actually transferable to different settings. What was quite interesting was a number of actually residents were quite happy with the tablet. They were saying actually it's good, it reminds them what to do, although they might remember, but it would help them. And it's good to be told what to do. For example, one of them was saying, it's good, to have the clock, because when you touch the tablet, it shows the date and time. So all the time it is reinforcing some of the information, but also sort of help them to think, okay, what time is it? If it is half an hour before lunch, they can go and have a cigarette if they wanted to. Some of this, small memory, or to have a cup of coffee, or et cetera, et cetera. Staff said it's not perfect, but it has added value because it stimulates. I think that was the main thing. It stimulates the users, the patients. But the main concern was really, although it shows different activity, but it's actually quite boring. Maybe it needs more information. And this was echoed by informal care as well. It was actually quite interesting when they were talking about what can we do to develop this one further. For example, they were talking about we can add DVD, we could add webcam, we could add photographs. So, the patients could, by looking at the photographs, keep remembering some of the issues. And it was very interesting, one of the patients was saying, my son has agoraphobia, he cannot leave the house, but he has computer, all these facilities. It would be nice to be able to see him because he doesn't come and visit me. So if we could develop that one and have internet and webcam, we could utilize more. Yeah, okay. I'm talking as I am sort of going that. of the main concerns was, again, this technology, I don't know those of you who have developed or working, unreliability of technology was a big concern. Often it interrupts, or if people don't use it, only the screen would show a fish. And if for those people who have moderate dementia, I think that's it, and they are not going to be using it more. So the idea was maybe, even if people are not using it, every 5 minutes the scenery could change, and that change of scenery could be a stimulant. And informal carers were saying, yes, by actually repeating some of this information, that could, that could, in a way, really stimulate the memory, so reinforce remembering some of the issues, which they may not remember otherwise, and help them to think about some of the activities. When we asked them really what needs for further development, most of them really were saying it is very important because again, patients are different. The issue has been raised already. One size doesn't fit everyone. So we need to bear in mind when we are developing this source of technology, whether we need to have different levels for different types of patient. Again, that was quite interesting to know. And the other important thing was how actually, when you display some of these issues, it's good on a day-to-day, but they wanted actually to have some overview of things is going to happen next day, some of the activities. So again, that shows the diversity of these 8 patients. Some of them would forget, didn't want really to know anything after, half an hour or half an hour before. But some of them wanted to know in order to be able to stay focused or to look forward for something is going to happen next day or next thing. Some of the issues I already mentioned, but really in efficient use of it, limited ease of use, lack of knowledge of stuff, because if the patients asked them to help them, staff would get actually very upset because they already had a lot of workload. That was extra work for them to come and show. But having said that, majority of residents were happy. The informal carers were not very positive about it because, again, they were thinking very rightly that staff who lives in the residential area don't have enough time to spend. So maybe either they need further training or the ratio of staff to patients needs to be increased initially. And of course, that has echoed with the staff's thought on that. The finding also highlighted that this type of tablet or this type of digital board can be actually utilized for other people in other healthcare settings, especially those who have sort of learning disability or whatever they call it, intellectually compromised. And it would be really useful to extend it, to have photos, DVD, etc., etc. So the overall theme showed that these type of tablets can aid memories and could contribute to the independent living of the clients. And as a result of that, a number of lessons have been learned how to develop it further. So we started then second cycle of development, but then after that, so we added all this information which has been mentioned, and then we sort of implemented with people who have learning disability and see really whether, apart from dementia, whether other people can also use or not. And what we noticed was, again, as you know, sort of people with learning difficulties, they are diverse type of needs. But it was quite useful. And for the second cycle of information, we gained some more information and we developed that further. But it is important to do further research to see whether this can be generalizable to other settings or not, because again, the diversity of the needs of this type of patients is very important. But one important issue we learned from this exercise was we should not be underestimating people who are suffering from dementia. They should be involved in research. Their needs are as important, and allowing them to express their needs as important as other stakeholders. In summary, the tablet's gone through, as I said, first, second, and third cycle of development. The first cycle was carried out by our master students, so really, again, as a higher education institution, the importance of involving a student in developing and designing this type of tablet. And at the moment, then for the third stage, actually, we worked with a, what is called Zorgan One, whatever, is a company, software company in Netherlands. They have developed this one further, and now the tablet is available in the App Store, and it is called the Picto Planner. So really, as I said, it is started with a small collaboration, with a small scale living healthcare within with the university, and we reached after 5 years to this stage. So hopefully, maybe we can extend that to other settings. Thank you.